Ferguson.
Hey, thanks a lot, Denise, for the introduction, and thank you to ARI for having me, as well as to the donors for making this possible. So today's talk, I just want to spend some time going over some of the research that I've been doing here at the University of Missouri for the past 15 years or so, mostly on why do so many individuals with autism have GI issues, and kind of what our research has found, and then some future directions as well. With that being said, I'll just get going here. Disclosures, so funding sources, some of the work I'll be talking about today was funded by the Autism Speaks Autism Treatment Network, the Department of Defense, and the Center for Discovery, and I have no other disclosures. So, the prevalence of GI disorders and autism. So, it may not come as a surprise to many of you, but there's a lot of individuals with autism that have GI symptoms. So, I'm talking about things like constipation, diarrhea, abdominal pain. But the prevalence is really all over the place. So, anywhere from 9 to 91% of individuals with autism have been shown to have GI issues. And really, constipation, from what we're seeing, constipation is very common in autism. Using this Rome 3 criteria, so this is standardized criteria for GI symptoms out there in our research. So we found about 42.5% met criteria for functional constipation. So this is constipation without some type of physical cause that you can see. Perhaps this is a brain-gut or a disordered brain-gut interaction, or DGBI as it's called now. And about 12% had this irritable bowel syndrome. So, but regardless, we don't quite understand the etiology, or kind of what's causing these GI issues in autism. So, on our team here at the University of Missouri, and especially here at the Thompson Center for Autism, we are looking at these GI issues through a stress lens. Okay, and what I mean by that is we know from the research that many individuals with autism have a heightened stress response, and that's likely it's likely in response to their environment, right? So things that are going on around them. And what we think was going on here is we see more of this sympathetic nervous system activation, or this fight or flight response. So when there's two branches of this autonomic nervous system, there's this sympathetic and there's this parasympathetic nervous system branch. The parasympathetic nervous system is really responsible for resting and digesting, right? So when you're at rest, and your parasympathetic nervous system is really kind of turned on, if you will. This stimulates activity of the stomach, so it kind of aids in digestion, slowed heartbeat, things like that. When you're in this fight or flight state, the pupils tend to dilate, increased heart rate, and there's inhibition of the activity of the stomach. So, this is kind of our framework that we're working on, is that when you activate this sympathetic nervous system, and like I said, that you see this in many individuals with autism, perhaps that is what is related to a lot of the constipation issues that we're seeing. So we've done some research in this area, and looking at this gastrointestinal stress relationship in autism. And what we found is that there's been this heightened cortisol response. So cortisol is this, marker of stress, right? It's the end product of activation of this stress response, right? And you can measure that in blood and saliva and things like that. But what we found here is that there's a positive relationship between the cortisol response to a stressor and really the constipation here. What's also interesting is that we found some immune system relationships here as well. So more in this study of 120 individuals, we're showing that things like stomach aches right? Those are associated with the more stomach aches there are, the more likely there is to be some gut inflammation. So this research was published in 2016 in Brain Behavior and Immunity from our team here at the university and other individuals across the autism treatment, what used to be called the Autism Treatment Network. And then interestingly, we also looked at how does having an anxiety disorder and autism, how does that affect your nervous system response to the stressor, as well as how that relates to GI symptoms. So basically, if you were found to have a co-occurring anxiety disorder that significantly altered the lower GI tract parasympathetic nervous system relationship. So basically what that means is that if you got an anxiety disorder, it's related to your GI issues, most likely, in autism. So that's kind of the framework from that we've been working from. So why is this important? Well, obviously, having GI symptoms is not a pleasant thing, but then also these GI symptoms have been shown to be associated with problem behavior, as well as internalizing symptoms like anxiety and depression. So in this study that we conducted, this was a retrospective study that we used by looking at data we have here at the University of Missouri Thompson Center for Autism. So they keep really awesome records on patients, and they've all consented to participating in this research. So we have a really nice database from which we can do some research. So we looked at 340 children and adolescents with autism. Age was anywhere from 2 to 18 years of age, with an average age of about 5.5. And again, like I said, these are clinic patients from the Thompson Center for Autism here at the University of Missouri in Columbia, Missouri. And the autism diagnosis was confirmed using the ADI or the ADOS, which are gold standards for diagnosing autism. And so we had caregivers, typically parents, were filling out questionnaires on dietary problems. So were there any feeding issues in infancy, current feeding issues, picky eating, milk aversion, food reactions, things like that. And then nutritional problems. So is the child's nutrition adequate? Current GI symptoms, constipation, diarrhea, nausea, or vomiting, and stomach aches. And then we also looked at internalizing and externalizing symptoms from this checklist called the Child Behavior Checklist, or the CBCL, right? So the parents filled out all these questionnaires. And then what we did is we did some correlations. So we tried to look at, were there any relationships between the problem behaviors and having GI issues. Of note, we created two groups. What we call a younger group is 2 to 5 years of age, and then the older group was 6 to 18. And we did this because that's the way that this questionnaire, the CBCL, is divided up. So that's why we did that. So here's some information on the sample characteristics. So in the younger group, we had 200, and the older group, we had 140. Like I said, the younger group age range was 2 to 5. Average was about 3 years of age. So these are really young children. IQ in the average range, so average IQ is 100 in this case. So average IQ of about 90. And then the older group, these individuals, like I said, ranged in age 6 to 18 with an average range of about 9 years of age, and then average IQ. And so the groups were similar on all these criteria. So that's good for trying to make sure that you're making good comparisons. So what we found is for both the older and the younger groups, 65% experienced constipation, 50% experienced stomach aches or stomach pain, about 30% experienced diarrhea, 23% experienced nausea. And what was really interesting is that 93% of these individuals, their caretakers rather, said that their children were not taking medication for these GI problems. So for instance, like Miralax for constipation. So, what this tells me is that, these individuals are just kind of suffering through this, and that's leads to decreased quality of life. And so we're really trying to work on that and increase the quality of life for these individuals and their families. But 53% of them were taking medications for other reasons, so things like ADHD, for aggression and seizures. So in children 2 to 5 years of age, we asked, do the GI symptoms predict internalizing or externalizing symptoms? So again, these internalizing symptoms are things like, depression and anxiety. So really, your feelings, and then externalizing symptoms would be like, acting out. So being aggressive. And so what we found is that if the child had nausea, right, it significantly predicted their aggression. So, very likely what's going on here, and this is not surprising, is that, these individuals they're young, and they're not able to communicate their nausea, and so they are likely acting out as a result. So when we look at this older group, the 6 to 18 years of age individuals, so we wanted to ask, do these internalizing or externalizing symptoms predict the GI symptoms? So if the patient had anxiety, they were 11% more likely to experience constipation, but they were 9% less likely to experience stomach aches. Similarly, if they had withdrawn behavior, they were 11% more likely to experience stomach aches, but 9% less likely to experience constipation. And then similarly for somatic complaints, if they experienced somatic complaints, they were 11% more likely to experience nausea and 11.5% more likely to experience stomach aches. So, what did we find? Again, just kind of a summary. The majority of the participants reported constipation, which again was not surprising. A lot of research has shown this in autism. And the young children with autism who are nonverbal, they may be using aggression to communicate these somatic complaints. So, this is a really good reason to, obviously to address these GI issues, because they may also be related to externalizing behaviors like aggression. Regarding the older children and the adolescents with autism, they had more internalizing behaviors that were associated with GI symptoms, so anxiety and constipation, and withdrawn and depressed behavior was associated with the increased stomach aches but decreased constipation. So what does it all mean? The GI disorders and behavior problems that are related in autism, and they may serve as a communicative function of their discomfort. Okay. So moving on to another study that we've done, if you haven't noticed by now, I'm very much a stress researcher, so I'm going to be talking a lot about the stress research that we've been doing. So this study, we looked at the association between electrodermal activity, and all that means is just how much your skin is sweating, right? So, when you're stressed, your skin sweats. So we looked at the relationship between skin sweat and problem behavior in severe autism spectrum disorder. So these are individuals, this study took place at the Center for Discovery that's in upstate New York, and I'll tell you a little bit about it here. So really, what was interesting in this study is that this was not a GI study whatsoever. This is another study that I was working on as a graduate student, and it was a small study. So we had about 8 individuals. Here's the age ranges, and they were all male, largely Caucasian. And again, like I said, average intelligence is a 100, right? Mean of 100 with a standard deviation of 15. And so these are very lower functioning individuals, right? These individuals, many of them are nonverbal, and they are living at the Center for Discovery, and in receiving excellent care there. Adaptive functioning is also very low. And so again, these individuals are very low functioning. And what's interesting though, is that we also have information on their co-occurring conditions. So as you can see, constipation, vomiting, constipation, gastroesophageal reflux, constipation, right? So a lot of these individuals have significant GI issues, right? And then here's what happened in the study. So there at the Center for Discovery, they have a very nice classroom that's outfitted with cameras in the ceilings and microphones. And it's a classroom setting where there's teachers right here. This individual in the red is teaching these individuals. And this individual here is jumping up and down in their seat. You can kind of tell right here they're wearing a watch. And so what this watch is doing is it is recording the skin sweat. So it's able to tell us, how stressed they are. And here is a plot of what the stress data looks like. So as this blue line goes up, so does the skin sweat, right? So here in the A section, this is what we would call the baseline. So this is when they're likely not stressed. B, this is what we would call their anticipatory rise period. So they're starting to get stressed. And then C here is when the problem behavior occurred. And as you can see, like this is where the individual is likely, jumping up and down. Their data kind of moves around a little bit because they're very stressed out. And so what we found here is that there was a rise in this skin conductance about 60% of the time prior to the problem behavior occurring. And then the skin conductance returned to baseline, or what we would consider a normal level, about 45% of the time after problem behavior. But interestingly, the average rise in skin conductance before their problem behavior was about 10 minutes. So perhaps we can intervene here. But again, the most interesting thing about this is that many of these individuals who are showing these, increased stress levels that are associated with problem behaviors, they've also got gastrointestinal problems. So very interesting data there. All right. So I enjoy doing this type of research with the teams that I'm on, and but I don't want to just publish these things in journals and give these talks to you and just say, here's what it is. I don't know what to do. Well, so what we're doing is we are also trying to do something about this, right? So the obvious question here is, what happens when you treat the stress response? What happens when you reduce the stress levels in these individuals, right? Does it have any effect on core symptoms like sociability? Does it have any effects on gastrointestinal symptoms? We recently published some data from a trial of propranolol. So propranolol is a beta blocker, so it really blocks the stress response in children and youth with autism. And like I said, we looked at social functioning and anxiety and GI symptoms. In this clinical trial, the age range was 7 to 24, and all the individuals were diagnosed with autism. And they took propranolol for 12 weeks. And some of them took propranolol for 12 weeks. Some of them took placebo. It was double blinded. We didn't know what they were taking. They didn't know what they were taking. And after the 12-week course of propranolol, we found that there was a significant reduction in anxiety compared to the placebo. So these results are published, and very promising data that we're going to hopefully follow up on in the future with other clinical trials. And but my question here is, were there any effects on GI symptoms? So we're not quite sure yet, but it's a very interesting question. I've also done some work on the effects of propranolol on the relationship between GI and amygdala reactivity. Okay, so in this study, so this is a separate study from the clinical trial I just mentioned. We had 12 individuals, so 11 male and 1 female, participate in this study, and IQ is 80 or above. And these individuals attended 3 sessions. One session was where they came to a brain imaging center and they took placebo, and we did some brain imaging. I'll get into that in just a second. One session they came in and took Nadolol, So nadolol is like propranolol, but nadolol does not cross the blood-brain barrier. So you can, isolate the effects to the peripheral nervous system, peripheral beta receptors. So we have these beta receptors all over our bodies, and nadolol will block those ones in the peripheral nervous system, so it won't cross the blood-brain barrier. And then propranolol, this will block beta receptors, so it'll block that stress response in the peripheral nervous system, and it also crosses the blood-brain barrier. So you can attribute the effects of that also to the central nervous system. Okay. And then these individuals filled out a GI questionnaire, so it asks about things like abdominal pain, nausea, diarrhea, and other GI symptoms. So as I mentioned, this is what we call a functional MRI or an fMRI study. So what we wanted to do was activate their amygdala. So the amygdala, you've got this in both hemispheres of the brain, and this is your fear response area, right? So when this region of the brain lights up, it's in relation to something that's threatening that's going on in your environment, and it's extremely important for survival. Okay. So again, when this area of the brain is activated, it's very likely the individual is undergoing stress, right? And the way that we do this in an MRI, so maybe many of you have had an MRI, or you're researchers, you're familiar with this. I've got a wide audience out there, so I want to make sure everybody understands. So you're in the MRI, and we want to activate this amygdala, and the way that we do this is this face matching task, right? So we ask the individuals to look at these faces and match them. So if this face matches with this one, you press one button, or if this face matches with it, you press a different button, right? But all the while, we want them to just look at these faces, which have been shown to activate the amygdala. And so what did we find? Well, so these three graphs, this one is for the placebo condition, this is nadolol, and this is propranolol. So basically, what this is showing is that as the amygdala reactivity goes up, so did their GI symptom score, right? So what we're seeing here for the placebo and the nadolol conditions is that you see this slanted line going upwards. This is what we would call a positive relationship, right? For these drugs. But when you look at the propranolol group, this line is flat. So what this would indicate to us is that when an individual was on propranolol, their change in amygdala reactivity was not related to their GI symptom score. So what this indicates to us is that perhaps, this propranolol is acting centrally, right? It's blocking the stress response. It's shutting off the amygdala or dampening it down quite a bit. And this perhaps is related then to their GI symptoms. So we have not published these data. We are submitting this for publication. So these have not been peer reviewed. So hopefully we'll have those in the research literature in the near future. Okay. So there's also some future directions that we can look at, and right now our team is in the process of applying for funding for these things. So I talked a lot about propranolol, so that's obviously using a drug, if you will, pharmacological manipulation to dampen the anxiety and stress in these individuals. And that's assuming that the individual is going to have a stress response, right? If you can block these beta receptors all day long, but if you don't have something activating them, then it's it may not do anything for you. So enter this transcutaneous vagal nerve stimulation, or TVNS. So what this is, it kind of looks like a little earbud. It fits in your ear and it attaches to a little box with some electronics. And what this does is it stimulates the auricular branch of the vagus nerve. So the vagus nerve is part of the parasympathetic nervous system. So when you stimulate this, it's going to cause more rest and digest behavior. So then it follows that what happens to stress, what happens to gastrointestinal symptoms in individuals with autism when you do this, when you activate or when you stimulate this auricular branch of the vagus. So that's another direction that we're going with our research team, and we hope to have some funding on that soon. Okay. All right. So that's a lot about what we've been doing. So now I want to shift a little bit toward our current work. So all the work that I've talked about up to this point was done in a laboratory setting, right? And laboratory setting is not the real world. And so, when you're a stress researcher and you're trying to measure the stress response in individuals that a lot of them already have a heightened stress response, that's not the best scenario, right? And so there's really a need for more of this real world or ecological monitoring of stress and behavior in autism research. And luckily, the field of research in autism is moving this direction. It's largely moved this direction, and mostly due to things like apps, so like smartphone apps on your iPhone or your Galaxy phone or whatever you have, and then these can provide useful data in real world settings. And so there's a lot of research that's happening using these apps and smartwatches as well in autism. It's very, very exciting. So our team was recently informed that the Autism Research Institute, the ARI here, has funded this study, which we're very thankful for and very, very excited to conduct this study. And the title of the study that will be running over this next year in 2025 is Ecological Monitoring of Autonomic Nervous System Activity and its relationship with gastrointestinal symptoms in autism spectrum disorder. We're also going to be looking at, I forgot in here, should also say there's a social communication aspect of it, but I'll explain that. So what we're going to be doing in this study is we're going to be looking at differences in verbal social communication data from 30 autistic participants with GI symptoms and 30 autistic participants without GI symptoms over a 3-week period. We're also going to be examining differences in autonomic nervous system functioning through what we call pulse rate variability as it's related to GI symptoms in these same participants. So let me tell you a little bit about that. So what is pulse rate variability? Well, if you've got a smartwatch on right now, chances are it's looking at this in some way, and we've probably, a lot of you have seen, these smartwatches. You may look at it and see this little flashing green light. That is something that's called photoplasmography. And it's really been adapted from, pulse oximeters. So maybe many of you have seen these in healthcare settings, or maybe you have one at home. It's very similar technology that's in these watches, and it's able to give us what we call pulse rate variability, which is a marker of stress. And the way this works is it's looking at differences in the amount of light that's absorbed from oxygenated versus deoxygenated hemoglobin within red blood cells. And it's very similar to heart rate variability. So a lot of my study, we use electrocardiogram or EKG. This trace up here is from an EKG, right? So these parts here are, the main depolarization of the heart, or when your heart beats, right? And typically for heart rate variability, what we're looking at is the amount of time between these beats. And what that does is it gives us information on your stress state, right? So the more variation there is between these peaks over time, the more relaxed an individual is, okay? The more rest and digest that's going on in the body. And, opposite of that, the less variability there is between these peaks over time, the more stress an individual is looking at. So this is more of a laboratory measure of stress, okay, heart rate variability. And we're able to do that all day long. And people have been doing it for many, many years. So how can we do this out in the real world, right? Because that's really what we want to look at. And when we look at photoplasmography and obtain pulse rate variability from it, this is what the signal looks like. So it's similar, and you're able to get similar type of data from it. Like I said, it looks a little bit different, but this is more of the data that we're looking at from the photoplasmography. So if you've seen on your smartwatches, I don't know, I'm more of a Android person, so I know kind of what Android looks like, but it may say, like on your watch, it may say stress level, and it'll say, kind of green or blue over here is like you're not very stressed, and all the way up here to this orange, red, you're really stressed out. This is what it's doing. It's just, kind of making it really easy for you to understand. So we're really getting into the nuts and bolts of it here, and using this as a measure of stress that we can then use for obtaining this pulse rate variability, which again is a really good measure of the stress state of an individual in a real world setting. Okay, getting close to the end here, so thanks for hanging in there with me. So for the verbal social activity, so we've developed an application here at the University of Missouri in conjunction with Dr. Fong Wang, who's a professor in engineering. And we've developed this application that we've called Core Autism. I can't go too much into the nuts and bolts of it because we're still, working on it here, and we don't want this to get all out into, the open as much. But what we've done with this application is we've developed a way for the application that runs on a smartwatch that's worn on the wrist to measure the total amount of time spoken by a person wearing it. So we've done a few different studies at the Thompson Center for Autism here at the University of Missouri, where we've had individuals wear it in a laboratory setting and give us feedback on it. We've talked to their parents and their caregivers and gotten their feedback, and then we've tested it in a real world situation over a period of 2 or 3 weeks. And, this application records what these individuals are saying during their daily lives, right? And this is really important because the way that we measure sociability, right? For example, in the clinical trial that I talked to you about earlier, propranolol, the social measure went a little bit like this. So let's say that you had a younger individual. Let's say you had like an 8-year-old that came in, and they came in with their mom, and we would ask mom, okay, mom, how social was your child over the past month? Right? That's not rigorous. That's not a very good way of doing that. Moms are very busy. It's just not good. And it doesn't capture kind of what's going on in other environments where mom may not be present, right? The child may be really social, let's say, if they're playing video games with their friends, and that's sometimes done behind closed doors. So we're not really necessarily able to capture those encounters. So those social encounters. So this watch is really good for that. And basically, we've done quite a bit of research to make sure that this watch and application is actually giving us the correct amount of time spoken by these individuals. And the way that we do this is we have these poor undergraduate students who are in the laboratory. We have them actually listening to these recordings that we are obtaining from the watches. And then they have to start and stop their watch every time that person starts to talk and then when they stop talking over hundreds of hours. We're very thankful for their work they've done on this. And what we found here is we're really looking kind of at this orange line here is this is the average accuracy of the algorithm and how it agrees with what we're actually hearing or what the students have coded for us. And average accuracy here is above 90%. So about 90% of the time, what the student heard agrees with what the algorithm heard. So the watch, it's definitely it's not a perfect thing, but it's definitely a lot better than a lot of the social measurements that we have now. And then all this is saying over here is just the total amount of hours recording. So the people, the individuals with autism are participating. They're recording many hours for us over a 2 to 3 week period. So, for females, they're recording about 25 hours or so over that period, and then males not as much, about 18 or so hours. So really interesting work that we're doing here, and we really hope that this application can help with social assessments in the future, and we're very thankful for funding from the ARI to continue this work. All right, so I've kind of already gone over this, what we're going to be doing here, so I'll briefly touch on this. So with the study that we're doing, it's going to be in individuals aged 6 to 24. All of them will have autism. 30 will have autism with at least one GI symptom, and 30 will have autism with no GI symptoms. They're going to wear the watch for 3 weeks during their waking hours, and then they're going to record the verbal and stress data. So what do we think what are we going to find, right? What do we think we're going to see here based on previous research? So we think the pulse rate variability will be significantly lower for the GI group. So that'll indicate that reduction in pulse rate variability, again, is associated with a higher stress response. So basically, the more stress there is, the more GI symptoms that we'll see. And then for social communication, we think it'll be lower for the GI group. So we think there'll be less time spoken over the course of the 3-week period in those with GI symptoms. And we think this is possibly due to increased stress. All right, so what, right? I always like to ask that question. So what, Brad? What are we going to do with this? Why are we doing this, right? And so this provides real-world evidence of stress. So like I said, stress and sociability. So like I said earlier, a lot of the research we've done has all been in the laboratory setting up until now. So we want to see what's going on in the real world with these individuals, and we think that will lead to better data, better research studies. And laboratory studies, they're stressful, right? You've got to come into the clinic, and there's a bunch of people that you don't know. You've got to talk to them. Maybe they also had a clinic visit on the same day, right? I'm here at the University of Missouri, and we see a lot of people from rural portions of the state, and so a lot of them will come in the morning to see their physician, and then they'll come do a research study. And so that's really not the best way to do it, but that's what we do. Okay, a lot of the times. And so obviously that may not reflect their real world functioning. And then obviously if the stress is heightened in the GI group, this has treatment implications. Okay, so we want to know, in the future, what happens to the GI symptoms when the stress is addressed, but then the opposite as well. What happens to stress when the GI symptoms are addressed? So we don't know, right? These two are correlated, and GI symptoms and stress, but the end goal here is to improve the quality of life in people with autism. And so getting rid of the stress and or the GI symptoms is definitely not a bad thing. Okay. All right, so what are the take-home messages from my talk today? So GI symptoms are common in autism, especially constipation. These GI symptoms are associated with an enhanced stress response, so particularly for lower GI tract symptoms like constipation. These GI symptoms are also associated with internalizing symptoms and problem behavior, but this may differ by age, right? So the younger individuals may have more problem behavior. The older ones tend to have more internalizing issues. So things like anxiety and withdrawn behavior. The stress response may precede problem behavior in ASD. And what are some potential treatments that we could explore? So things like stress reduction. This could either be pharmacological, could be vagal. So like I said, with that TVNS, or it could be behavioral, but I don't know. These are just research questions, right? And perhaps, what are those effects on GI as well as problem behavior? So, and then obviously more research is needed in this area. And then the ARI study I mentioned, that's going to be completed in about a year. So hopefully I can come back in about a year after we start. So that'd be 2026, and update you with the results. And I look forward to telling you all about it. So I want to say thanks to all of our collaborators, the Thompson Center, the patients and their families for participating in our research. Huge thanks to Dr. David Beversdorf. Man, he's been a great mentor to me, and just a really awesome physician, and just cares so tremendously about these individuals with autism. It's really a joy to work with him. Chris Dovgan, who's been a big part of a lot of these studies I mentioned today. Nicole Takahashi, she is the Thompson Center administrator, a research core administrator, and she's been absolutely essential to having to these studies being conducted, and we really appreciate all of her help and support. The University of Missouri Coulter Biomedical Accelerator, who's provided some funding, the Department of Defense, Center for Discovery, and the Autism Speaks Autism Treatment Network. And with that, I will take any questions. Thank you.
Well, thank you. Thanks for your presentation. People are typing their questions into the Q&A section. So I'll encourage you, if you haven't typed your questions in there yet, be sure to get in there and start registering. So I will start here at the top. And these are just some observations from one of our participants. One person prefers when we say autistic people over individuals. I know you talked about that, or you mentioned both in your presentation. I just wanted to call that out, that some people prefer that language. This person also talked about having sensory overload, and that their senses are always on, and it's hard for them to screen. So they're talking about that experience that they're having personally as an autistic person. But moving on to some of these other questions, one question that we had was about the difference between propranolol and Prozac, which are very different medications. Can you talk a little bit about the difference between those two things? I know one is a SSRI and the other one is a blood pressure medication, I believe. So.
I really can't. I don't feel comfortable doing that. One thing I didn't present here was we found, and this is in the research literature, there's this relationship between serotonin levels, so specifically increased serotonin levels, so what we call hyperserotonemia, and gastrointestinal issues. And so I do know that those two are related, specifically for when you're talking about gastrointestinal motility, right? So the more serotonin that you see, particularly in the whole blood samples, the more likely there is constipation. That's from our research. Sarah Marler is the lead author on that, followed by me and a few others. But I really can't speak to that because I'm not a physician. I'm a researcher, and I don't particularly work with SSRIs, but that's about the only thing I can make a comment on.
Got it. So if people want to find out more about that, they can go and speak with their own clinicians about that.
Absolutely. Yeah. Everything I've talked about today, this is not medical advice. You definitely need to talk to your physician before trying anything.
Okay, so here's a question about interoception. So they're asking about, does interoception sensory play a role in stress and challenging behavior?
That's a really good That's a really good question. I'm not sure. It's not quite my area of research, right? You said interoception.
Yeah, interoception says that's that internal pain that isn't always detected.
Yeah. That's a good point. I've heard some research on that. Where some individuals, it may be heightened in some people, but then some people it may not be. I'm not really sure. Yeah, like I said, we don't study that much, so I don't think I can comment on that. I'm sorry.
So this person's asking about quote verbal social activity that was touched on. Does this also measure the anxiety experienced during those interactions? So
Yeah,
there,
so you go ahead.
yeah, that's it.
Okay, so yeah, so that's exactly what we're trying to do here. So one of the problems in research in this area is that we're not able to measure the stress and sociability together at the same time, right? To where they are time locked. And so with this application that we've developed that works with the smartwatch, we are able to do that. The other cool thing about this app is that we are able to, we haven't done this yet, right? This is all in development, is eventually use the GPS functioning, so location of the individual and where they are in their world. And we can look at where are they most stressed, right? So are they most stressed at home? Is it at school? Is it wherever, and how does that correlate with any treatments that they're undergoing, right? Um, so yeah, that's a really good question. So that's kind of where we're going with this, is being able to look at those two, the social communication and stress levels together in tandem, and see what is that relationship with GI. And then we can also look at other things too, right? Not just gastrointestinal problems, but also really anything, problem behavior, or like I said, treatment response to any type of intervention. So
Okay, great. So the next question, could you repeat the name of the second intervention? They're saying here, was it TVNS? They were just asking you to clarify that.
oh yeah, transcutaneous vagus nerve stimulation, TVNS. So again, these are just, I'm sharing with you my ideas and things that we're looking at to spark these types of conversations. So again, I have no clue if this would work, but these are things that we're submitting for funding and for peer review, obviously.
Right. Not prescribing these as interventions, but rather, yes. So there are a lot of questions about different interventions that people experience. So one thing here, have you done any research related to nutrition and diet as part of your work? And do you have any thoughts about that?
We have, and we've largely found that the diet was not related to GI symptoms in autism. Now, that's what we found, right? I have to speak very carefully here because there's a lot of people out there that will look at things like picky eating, right, in autism, and perhaps that is related to these gastrointestinal symptoms. Unfortunately, when the way that we do research is we look at averages, right? So there's individuals that are in our samples where perhaps their diet is related to their GI symptoms, but unfortunately, when we look at the averages, that they're not represented very well. And that's really why we're moving more toward this, what we call precision medicine, is being able to determine, what's going on, considering the person, right? So not just considering the average and how groups, perform on average, but how does Brad Ferguson perform? How does Denise Fulton perform? What does health look like for you based on your uniqueness And so, but yeah, we're definitely considering diet going forward, because obviously it's related to, your overall health, including GI health. But in general, the research we found, and we looked at micro and macronutrients and how they are related to GI symptoms, they were not. And that is in the research literature.
Hey, this person's asking, have any of these studies included factoring in genetic conditions that are co-occurring with autism? So they're wondering about specific genetic conditions that are related or can be referenced for addressing GI issues.
We have not. There is there's a gene that I know that's associated with autism, albeit a small portion that it's associated with GI symptoms. But I haven't looked into that. But we're definitely open to that.
Okay. Lots of questions here about using Miralax, comments about pros and cons of doing these different interventions for constipation. Do you have any other thoughts about your observations about constipation?
Well, obviously, you need to talk to your physician if you are interested in those types of things. I can comment on, what I'm seeing when I see a participant come in for a research study, right? So like I said, I'm not a physician, I'm not treating patients, but I definitely spend a lot of time with autistic individuals and their families. And what I hear is a lot of them try things like Miralax, and maybe it works for a little while, and then maybe, it doesn't. It's kind of a mixed bag though, but I definitely hear from a lot of families that say they've tried everything. They've tried different diets. They've tried, Miralax. They've tried different medications, and it may work for a little while, and then it doesn't. And then some people, they find something and it works for them, and it's great, and it clears things up. But largely, what I'm seeing is that the case is that the constipation persists regardless. And that's why our team is really looking at the stress response, right? Our thought is that, if you can do all these treatments you want, and again, this is not medical advice. These are just my thoughts here, having a conversation. But as a scientist, my thoughts here are that if these GI symptoms persist, perhaps there's something else that's going on. And I think one of the biggest culprits is stress, right? So that's why we're studying stress in this relationship, in hopes that we can, reduce the stress, because that's never a bad thing, right? And hopes that it will help improve the quality of life.
So this next question is about differentiating between verbal socialization versus monologuing or verbal self-stimming. Is that something that you've in this work that you've had to figure out and tease out?
So I'm sorry, did you say internal, or is it more like talking to yourself, or?
Yeah. So trying to just differentiate between social communication language and then stimming and that type of verbalization, and any of these, because you're using different observation evaluations. So
right. So we have definitely considered that. So for things like, verbal stereotypies, right? So repeating the same word over and over again. So that's something that we're working on with our algorithm that we're developing, that we've developed, to be able to detect that. The work that I presented today is still fairly new, and by fairly new, I mean we started working on the app to record these verbalizations back when the pandemic started, 2020. So it takes a long time. And so the short answer to that is no, we haven't looked at that specifically. However, it is on our to-do list. And I hope to update you on that soon,
Yeah, with the work that's coming. So in next year's webinar, we can learn more about that.
You can ask me again. Yeah. No,
Yeah.
that's a great question. It's very relevant. But really what we're focusing on is, these verbalizations, that are occurring naturally in their own environment, right? And as well, I play video games, so I know how it is, and a lot of these people also play video games, and they may not be talking much to their family, but then they go in their bedroom, shut the door, and they're playing video games and talking on Discord or whatever. And that's I feel like we're really not capturing those events very well, and so hopefully with this watch we will. And again, there are privacy concerns. Everyone consents to this, and so we're also, like I said, we engage in what's called participatory action research, where we include autistic individuals through every step of this to give us their feedback, and then we incorporate that feedback into the design of the application as well as how we run our research. So
So we're almost out of time. I did want to ask, people are asking about getting a copy of the slides. We do include those in the playback. So Dr. Ferguson, I'll leave it up to you. If you decide to send a PDF, I will post that on the playback page. If not, you can always review those slides when you watch the video. Okay.
Great.
So we do have some other questions just about, what are the experiences that people with autism have when they wear the watches? Have you had any kind of issues with people, just discomfort or resistance to that? What are your thoughts on that?
Oh, that's a great question. We've spent quite a bit of time with that. I do want to say that, obviously all of the autistic individuals we have run through the study have been verbal for obvious reasons, right? Because we're collecting verbal. So a lot of those individuals tend to not have as many, at least in our experience, they haven't had reported sensory sensitivities. We offer different watch bands, should one prefer a certain type of material to another. And so we've done that in a couple of cases. We haven't had any issues with it. Obviously, if a participant doesn't want to do the study, they don't have to, and and that's perfectly fine. All these research studies are completely voluntary. And so, but if, like I said, if we have those issues, we recommend just not wearing the watch as tight, or maybe switching it from the left to the right wrist, or like I said, trying a different band, watch band that may be more comfortable. I think Denise might be frozen, so
yeah. So looks like Denise's internet went out. I'm Megan. I also work for ARI here for backup today. It looks like we've actually answered all of the questions that we had. We've got one more about your future plans for research here. Do you guys plan on studying the effects of any more natural remedies like CBD, chamomile, or L-theanine, effects on calming the GI systems versus using other drugs or prescription medications?
Sure. Yeah, that's great. I personally do not. And, when you start getting into things, like that, like I said, I'm studying what we've been studying because, of the research teams that I've been on. And unfortunately, it really comes down to funding, right? And we could talk for hours about this. But the short answer is no, I have not. But I know that there's groups out there that are studying things like CBD and its effects on anxiety and autism. There's some research literature out there on that. And so you might want to look into that, but our team is not. We're mostly focusing on this propranolol, and hopefully, maybe if we can come across some other things that are not a drug, things like, say, paced breathing, for example, we've thought about, so just slowed breathing to relax, that would be great, right? Not having to take a drug. So those are things we've considered. But